Hello, this is Manny Ramos, your host of Rise Up, Real Issues and Stories of Every One of Us podcast. But first, let me talk about who we are. I'm Manny Ramos, a board member of PNAA and a past president of the Philippine Nurses Association of Central Florida. I'm a professor of nursing at Valencia College in Orlando and an adjunct faculty at William Patterson University. With me today is my co host, Mindy Ofiana. Mindy?
Thank you, Manny. Welcome, everyone. I'm Mindy Ofiana, Legislative Committee Chair for PNAA, Corresponding Secretary for PNAA Foundation, and past President of PNA Southern California. Before my retirement, I served as both a Chief Operations Officer and a Chief Nursing Officer at one of the medical centers owned by KPC Group of Companies. Manny?
Thank you, Mindy. We're honored to join us today on Rise Up Dr. Jeanette Livelo. Jeanette is the nurse director of the Medical Intensive Care Unit at the Massachusetts General Hospital in Boston. She currently serves as the executive director of the Filipino Cancer Network of New England Foundation, Inc., and is the past president of PNA New England. Dr. Livelo received her Bachelor of Science in Nursing from Far Eastern University, a Master of Science, and a Master's in Business Administration from the University of Massachusetts. She earned her Doctor of Nursing Practice from Regis College Institute of Nursing. Dr. Livelo served as a PNAA Executive Board member for nearly 2 decades and is a PNAA Leadership Fellow and received multiple leadership and management awards. Good evening, Jeanette. Welcome to Rise Up.
Thank you, Manny. And good evening, everyone. Good evening, Mindy.
Good evening.
It's a pleasure to have me here presenting to you. Thank you so much.
Thank you. So, first, we'd like to find out, Jeanette, where are you from? Were you born here or in the
I was
Philippines?
born in Marinduque in the Philippines. It's a small island. But when my mom and dad got married, they moved to Oriental Mindoro. It's a Pinamalayan. It's a small town almost close to Romblon, which is Visayas. So when I speak Tagalog, they thought I was a Visayan because we're close to the region of Visaya. But I'm Tagalog, yeah. And then when I went to school in Manila, I was 16 years old for my BSN. I moved to Manila and I never really went back home unless for vacation. And so I graduated in 1980. It's the 4-year course. That's why it's called ATB. And I work at the Philippine Heart Center for Asia at the surgical ICU for almost 4 years before I migrated to the United States in New York City in 1985.
I see. So why
Then
did
I
you
moved.
become? Oh, I'm sorry, Jeanette.
Yes,
Go
I
ahead.
moved
Go
to
ahead.
Boston when my sister arrived here in Boston. She's also a nurse. It was in 1989, so we moved here in Boston since then. Yeah.
I
Lindy,
see.
you're asking me
Yeah,
something.
my question was, why did you become a nurse?
When I was growing up, I think I was 3 years old, and my aunt is a nurse. And I was just looking at her and I said, I want to wear white. And I had my cap on at 3 years old, always looking at the mirror. And so every time I draw someone, it's a nurse. And so it never really faded. I mean, I knew when I went on elementary, they ask you, what do you want to be in the future? And I always want to be a nurse. And at one point, yeah, I did thought about chemical engineering because I was really good at math. But then my grandfather told me that I'm too skinny. The chemicals might go in, and then I'll get more skinny. And he says, no, just go do nursing. So I did. I'm very happy to be a nurse.
That's good.
Yes. And you're doing very well, and we actually want to thank you for all of the contributions and the things that you bring to PNAA. And I'm sure as a nurse director there at Mass Gen, so I want to talk a little bit about you as a nurse director in a medical ICU and COVID. What has it been like running an ICU during the pandemic?
Yes. Um, It was tough. I think I don't know if you heard. Like my mom and I went back home to the Philippines in February,
Mm.
and we
Mhm.
didn't really set foot on the ground. We flew back to San Francisco, Hong
Oh.
Kong, and San Francisco because at that time our president did not allow us to disembark because I'm an American
Oh.
citizen, and my mom forgot her Philippine passport, so we were sent back to the United States, and I was quarantined for 2 weeks. So that was February 3
2
when we
weeks.
arrived back to the United States. I quarantined for 2 weeks. There's a couple of instances already in Seattle, Washington, and then one a student in
Mhm.
Boston. The whole hospital has been preparing for a potential outbreak.
Mhm.
Mhm.
So we knew that it may happen. Um, and
Mhm.
and what happened is that I came back to work on the February 17. We're preparing for
Mhm.
something until the end of February at the conclusion of the Biogen conference.
Mm.
We were
Uh-huh.
told that there were some exposure that happened. But then by that time, about more than 100 of attendees already flew back to the different states.
Mm.
And so they started contact tracing. It was the first weekend
Uh-huh.
of March when the governor said
Yeah.
that we certainly have an outbreak at Boston, and so we
Mhm.
made a makeshift in the ambulance area for testing. And so it was a
Yeah.
Friday afternoon. I already went home and I heard this call because my unit, the MICU, is the Ebola
Mhm.
response team of the hospital and of
Okay.
Region 1. So my staff were the
Right.
first one to be tapped to go to that
Uh-huh.
makeshift center to do some testing because they know how to don and doff
Yeah.
PPE. And
Right.
so I said, should I come back to work? And they said, no, no, stay put. I think we're in control.
Mhm.
And that weekend, there's already several patients that came to the MICU, but not
Mhm.
COVID. It's like rule out respiratory infection
Uh-huh.
is what they
Mhm.
they they diagnosed them with. But it's like one after the other. That whole week from March 6th to March 13, we filled up our intensive care unit.
Oh, wow.
And by the time I came back, like over the weekend, I was on the phone all the time. I was going to work very early, going home late at night. I wasn't
Mhm.
sleeping well. I wasn't
Oh.
eating well.
Mhm.
Unfortunately, I'm due for a colonoscopy on March 16, I believe. It was a
Mhm.
Monday. And
Mhm.
after that weekend, it's been very tense and stressful.
Mhm.
We have a lot of patients who are dying already, about
Oh,
three of them
wow.
Oh.
simultaneously and they're young professionals
Uh-huh.
because they had full blown COVID. And of course, nobody
Wow.
knows how to take care of them first
Yeah.
at
Mhm.
that time. And so when went
Right.
home, because I have a 3 day weekend off because of my colonoscopy on Monday, when I went to the hospital, I had a slight fever, very low
Oh.
grade
Oh.
fever. And so they let me stay there for a little while, about an hour. And then my gastroenterologist came down and they said, we talk about your case, but we really cannot do your colonoscopy with you having a low grade fever. And I was
Uh-huh.
telling them,
Mhm.
it's probably because I was dehydrated.
Uh-huh.
And they said, no, I
Mhm.
think, the COVID right now, we cannot take the chance. So they sent me home. And
Oh.
Uh-huh.
and so I called my hospital and I said, I can come back to work now. They didn't really give me any sedation. And they said,
Uh-huh.
no, stay there. We're
Mhm.
doing fine. But then that night, I had
Uh-huh.
my fever
Uh-huh.
went up, and then
Mm.
I have a lot of gastrointestinal symptoms. I keep going to the restroom. I thought it was norovirus. I was
Mhm.
not paying attention
Mhm.
to it. But on the third day, I was told by the hospital that I should get tested. So I
Um.
drove
Mhm.
myself to the hospital. I got the flu test and also the COVID-19 test. The flu test
Mhm.
came back 48 hours later. It was negative, and that's when I felt like, oh my God, I hope this is not COVID.
Mhm.
Yeah.
I was still doing fine,
Mhm.
so I stayed home.
Uh-huh.
Because of the weekend, we don't have the rapid testing at that time yet It took
Uh-huh.
about,
Yeah.
it's like 3 days. They said it will turn around within
Yeah.
3 days. So it was Wednesday afternoon when I had it. The 3 days is Saturday. So they kind of hold it because there's no testing going on weekend. And I finally got the
Mm-hmm.
result on Tuesday, about 7 days later.
Uh-huh.
But then I
Mm-hmm.
was not doing very well at the time, but I'm still in denial.
Oh.
I went to the emergency room prior to the test coming out, and I requested to be brought back home. I
Uh-huh.
said, I'll just go home, I'll stay there. They gave me a liter of fluid, and because I was so dehydrated, it was my
Yeah.
CNO. 3 days later, after the test came back, she called me, and while we were talking, she said to me, you need to call, you want me to call 911? And I said,
Oh,
why? I said,
why?
Mm-hmm.
you don't sound good, Jeanette. And I said, what do you mean? I'm fine. I said, no, you're so short of breath. I didn't even
Uh,
Uh-huh.
realize it. I get so used to it maybe. And they
uh-huh.
said, you
Uh-huh.
need to come to the hospital now. And so
Oh.
Rochi and my sister brought me, because I
Mm-hmm.
said, no, don't call 911. I'll have someone bring me to the hospital. Right after that, they direct admitted me to the ED for a short period. And then the x-ray was full-blown COVID on my left lung,
Ah.
and
Wow.
also some
Wow.
pockets on the right. So
Mm-hmm.
they brought me to the
Wow.
ICU, and they want to intubate me.
Oh.
Mm-hmm.
I
Wow.
begged, I said, please don't intubate me. I think I'll be fine. Just give me a few
Mm-hmm.
days, because I really don't feel like I'm short of breath, but my oxygen saturation is plummeting down to 85 every time
Wow.
I
Mm-hmm.
speak.
Mm-hmm.
And so I said,
Yeah.
can you try something else? And they gave me this
Yeah.
nitric oxide via
Mm-hmm.
a BiPAP mask. And I had
Uh-huh.
that
Yeah.
twice a day.
Uh-huh.
I lasted for 3 days, but on the third day, on Sunday, so I was admitted Thursday. On that Sunday, I was so tired,
Uh-huh.
and
Mm-hmm.
I knew then that I needed to be intubated.
Oh,
And
wow.
yeah, so that was it. I was the one who told me, yeah, go ahead, you can intubate me. I really thought I'm gonna die, because that's
Oh,
what I
wow.
saw with my patients in the medical ICU prior to me getting
Mm-hmm.
Uh-huh.
sick. So
Uh-huh.
I thought, like,
Mm-hmm.
oh, this is it. And
Oh.
Uh-huh.
yeah, and after that, I was intubated, sedated, paralyzed,
Wow.
Yeah.
very hemodynamically unstable. I was prone
Yeah.
16 hours a day. I had, my
Yeah.
fever was up to 103. They think I'm gonna have seizure, but I
Mm.
didn't know anything
Mm-hmm.
because I'm already
Oh.
sedated and paralyzed.
Oh, I see.
The
Right.
struggle I had was more when I was extubated the first time. I had a lot of delirium and
Uh-huh.
confusion,
Yeah.
Oh,
and I didn't
wow.
even know that I didn't have a voice, and so they needed to intubate me to prevent my larynx from
Mm-hmm.
closing because it
Uh-huh.
was so swollen.
Uh-huh.
I end up
Wow.
being trach.
Oh,
And so I
wow.
had a lot of dreams and
Uh-huh.
nightmares during that time frame. Thank God I was extubated 2 days later, the second extubation.
Uh-huh.
But I was so weak. It was 14 days later that
Oh,
I was
wow.
finally able to get out of the ICU, went to the regular floor for 7 days, and then rehab for another
Mm-hmm.
8 days, and then home.
Wow. Oh, wow.
Yeah, so that's my story. Um, yes,
So,
the sad part,
Wow.
because you asked me about how did I do when I came back to work, I was excited to come back to work. My PCP and the occupational health nurse said that
uh-huh.
it may take six
Mm-hmm.
months for me to recover, and they don't
Oh,
want me to go back to work because they said I might have PTSD, seeing the same
Mm-hmm.
place that I was when I was sick. And I
oh.
said, I need to find out if I can do it, because
Mm-hmm.
if you don't
Mm-hmm.
let me come back, I will not know.
Uh-huh.
Thank God I did well,
Mm-hmm.
but it was tough because
Uh-huh.
my staff was really hurting. They were so worried about
Mm-hmm.
me. They were excited I'm back, but they're guarded because it's like, is
Mm-hmm.
she really okay
Yeah.
coming back? Yes.
So, with all
Yeah,
oh, go ahead. Go ahead. Go ahead,
it-
Jeanette.
I think the most challenge I had was to make sure that my staff are remain cohesive, because they told me they felt
Mm,
Mm-hmm.
like they were split up because
mhm,
because we're the
Mm-hmm.
biothreats treatment center, my
Uh-huh.
staff has been deployed to different ICUs so that they can train other nurses.
Uh-huh.
And so they said they were split into four. Like they went to one makeshift ICU. The other team stayed in the MICU, but very understaffed. They have like 9 ECMOs out of 18 beds, and
Wow.
they are doubling patients, and they are matched with a med surg nurse. Then there are those who sought accommodation, which means they are brought to the a lighter
Uh-huh.
assignment,
Uh-huh.
and then the others stayed home.
I
They were
see.
allowed to stay
Mm-hmm.
home because they're
Okay.
immunosuppressed. So they felt they were not the same team anymore. And
Yeah,
that was
Mm-hmm.
really the challenge I had, is to get them back together.
I see.
Yeah.
So with all that
Which
experience,
I
with all that experience that you have, Jeanette, how are you now? How are you?
think I'm feeling really better. I feel that self-care is so important. I think that's one thing that I would advise everyone.
Mm-hmm.
Say no, take
Mm-hmm.
care of yourself. I also know that there was one comment that I received from one of the staff when we were having a resilience rounds. And I made a comment to one of the staff that I said, I'm so sorry you feel that way. I feel for you. And she
Mm-hmm.
says to me out of the blue, she says, how will you know how to feel, Jeanette? You were not even here.
Oh,
So that was
Mm-hmm.
Jesus.
hurtful, but
Yeah.
I kept my focus, and I said they must be really hurting to say that. And
Uh-huh.
so
Mm-hmm.
I conducted several focus groups so that they can express their their lived experiences, and it was so helpful
Mm-hmm.
because everyone, they learned about what I've been through. They wanted to learn about what
Mm-hmm.
did you do? What is it true that patients who are intubated, sedated, and paralyzed are confused or delirious? I said yes, it is true. So they wanted to hear that. And out of that focus group, I was able to send staff to different committees when we did the surge planning. All of them are
Mm-hmm.
represented. And also, I told my ACNO that, as soon as I came back, I mean, I cannot see them struggling to get some help. I'm going to hire. And she says, how
Mm-hmm.
many are you going to hire? I says, as many as I can,
Uh-huh.
and she approved
Mm-hmm.
it. So I was
Oh.
overhired by
Okay.
about 10 FTEs,
Mm.
but I'm so glad I did.
Uh-huh.
I'm so,
Uh-huh.
like right now, there's a lot of movement going on, and
Uh-huh.
I just keep
Right.
feeling them. I mean, I have a lineup of people wanting to go to the MICU, but I hired 26 nurses
Uh-huh.
um,
Wow.
in less than 15 months. They're like
Wow.
like 4, 3, 2, 1 every month, and until now I have another new grad, and I hired another three. So by the end of December, I hired a total of 30 nurses for 18 months, and that
Wow.
really helped because I mean I have an 18-bed ICU, and I could provide one-to-one staffing. On top of that, I have the resource nurse on top of everything, because I mean they're newer
Mm-hmm.
nurses, less
Yeah.
experience,
Right.
so you need the support. And I'm so glad I did that, because some of my colleagues didn't do it, and they're struggling, and I'm still
Mm-hmm.
hiring travelers on top of everything.
Oh,
Like I
wow.
said to them, finance will
Yeah.
come second. Right now, I need manpower on the bedside. No
Right.
nurse, we cannot take care of this patient.
Mm-hmm.
So that has been my mantra until
I
now, and
see.
it's worked.
Yeah.
It really worked.
Good.
Yeah.
So you talked about that original group that you know your I'm assuming you had like a core group of nurses who's probably been there for some time with a lot of
Mhm.
experiences. How are they now? Did that group you also mentioned about some of them being distributed across the
Right.
hospital? Are they all back together? How are
So
they?
when I did that focus group, I was able to get them back together. Like
Mm-hmm.
the staff that wanted to leave nursing or go to another area when I was returning,
Mm-hmm.
I was able to talk them into staying, and they
Mm.
stayed. I really the
Uh,
only out of all the staff that I had, it's about 140 of them. Only two
mm-hmm.
left in December of 2020, because one went to New Hampshire because of her husband,
Mm-hmm.
and then the other
Mm-hmm.
one is so tired of traveling uh, from New Hampshire border and Massachusetts. She says it takes me about an hour and a half to go to Boston. So she got a job closer to where she lives.
Yeah.
Those are the only two that I lost in 2020.
I see.
I got everybody back in.
Wow.
There's a very different style right now of the nurses. They are leaving, going to other places in the hospital, like the infusion center, ambulatory. Like I lost three of them, November, and then two in December. They're still with me, but they're moving. And then two went to travel nursing, so that's five. So I lost one, but that's it. I didn't lose anybody else from that 140. It was originally 120, but then I added more staff. So my turnover rate is still below. It's around 4% turnover rate in Massachusetts,
Wow.
and my
That's
turnover rate is
commendable.
less than 2%.
That's great.
But I'm anticipating it will not be like that in 2022. I have a feeling I'm going to lose some people. Not necessarily because they don't like the job anymore or they don't like being in the MICU, but during the pandemic, I usually have, prior to pandemic, I usually have about 3 or 5 nurses that goes to grad school. They become nurse practitioner or CRNA. So I keep replacing them like that for like a promotion. But during the pandemic, 11 nurses went to grad school.
Wow.
So they're going to be graduating now in May. It's a 2 years one.
Yeah.
Yes. So I have to replace them, and that's how it's been. It's interesting because I was telling my colleagues, I'm not really losing them because they don't want to be in the MICU. I'm losing them because they're going to be promoted. They went to school, grad school, and I'm very happy for that. So, so it's exciting that they're looking at the career move. But I'm also thinking that I gotta have to speed up with recruitment because the 2022 will be a lot more different than 2020. See, the 2020, we are thinking that the pandemic will be over in a year, but now we're almost on the second year, and I really feel that my staff are tired, very tired, especially when we take care of patients who are unvaccinated. They're not vaccinated. It's like, Jeanette, I don't know. I mean, this is my role. This is my ethical part of me, my moral part of me tells me that I should take care of their patient. But when I think about my family, that I'm putting them at risk, it's that's the kind of conversation I'm having with them now.
I see.
Yeah.
You talked
Work-life
about
balance is big.
Yeah. You talked about recruiting more than FTEs that you need, and you did a good job. Even though these individuals are being promoted, you're still going to be having more FTEs. Where did you get them? No, really.
That's a great question, Mindy.
Because we're having a hard time here in California.
We're a finance person. I love numbers, and the funny thing is that we have an acuity system. And I was begging the nurses, you gotta have to document your epic, put everything in there. That will translate to the number of FTEs that I will ask every time the budget process comes in. Keep the beds full. Whenever it gets empty, get another patient in. Don't delay, because it will translate to FTE. So volume and acuity equals FTE. And I tell this to the staff very much. They know it already.
Yeah.
And that's how I get them.
I
Like
see.
I already forecasted, and I will tell them that, in 3 months from now, these are the people that are leaving because they will be getting another position. They don't have a position yet, but I know they will be, because I'm going to help them find a nurse practitioner job at CRNA. So I speak to my ICNO and my CNO, and I said, I need to make sure I have to be ahead of the game. And they approved me. I mean,
That's
it really
good.
is, because they know. I mean, I never close beds. The staff, even though they are down, like if the acuity is high, and there's only like less than 60 nurses, when in fact they should have 18. They work around it so that I don't have to close bed or delay any admission. They know they know it's good for them anyway.
Sure.
So that's how I get them.
I
It's
am
not magic.
amazed.
It's a lot of moving targets and a lot of teamwork and cooperation from the staff. I would not
Yeah,
have done it without them, without
that's
their
true.
help.
That's
Yeah,
true.
Mhm.
yeah.
So, Jeanette, I'm sure with all of these things that has happened, during this pandemic, how has is the composition now of your staff?
Mhm.
Is there like a significant difference as far as you were telling us you've been hiring? How's the composition now of your staff compared to the start
Yeah.
of pandemic and
Yeah.
now?
So
Yeah.
I've been in Mass General for 8 years. And one of the things that
Mm,
I do every year is do a pie graph. Me,
Mm,
Manny and Mindy, they know I
yeah,
like the
yeah.
graphs. So I
that's
do
true.
that. I present it
Yeah.
to the staff. I present it to my boss. And in the very beginning, I have about, it's kind of lopsided. I have 50% more seasoned staff, meaning they are like
Mhm.
anybody that's 10 years and above,
Mm-hmm.
and
Uh-huh.
then
Uh-huh.
about 25% are 5 years to 10 years, and then
Mm-hmm.
another
Mhm.
25% are 0 to 5 years. And then as I
Mhm.
started working on FTEs, like every year I add 3 to 4 FTEs since I've
Mm.
been there.
Mhm.
Mm-hmm.
So
Mhm.
in doing that, I kind of sliced the pie a little bit differently. So I made
Mm-hmm.
it four, like, the first uh, 20 years and above, 10 years and above, five and one.
Mhm.
So for the last
Yeah.
4 years, it's been the same. It's like starting the newer staff, which is 0 to 5 years, are
Mm-hmm.
starting to grow because I'm
Mm.
adding.
Mhm.
So they are
Yeah.
between 50 to 60%. And
Mm.
then the
Wow.
seasoned nurse are about 30%, and then the other 20 is between 10 to 20.
I
And
see.
so
Mhm.
now it does change a little bit again. In fact, on Thursday, I have a leadership retreat. So I'm showing them right now the those who are 0 to 5 are
Mm-hmm.
still 60%.
Oh.
But the
Mhm.
0 to 1 year is about 30% already. So, which
Mm.
means that, I
Mhm.
have a very young group of nurses.
Yeah,
Yeah, it's still
Right. Right.
60%, but then the 0 to 1 year is half of that 60%.
I see.
So, a lot of the
Mhm.
focus now is making sure that they stay for their second year.
Mhm.
Mm-hmm.
Number two, make
Mhm.
sure that they are competent enough and get their skill set up to snuff like the seasoned nurses.
Mm-hmm.
And then
Mhm.
three, I wanted to make sure I know their career path so that I can forecast that, I'll be happy if they stay with me for the next 2 years.
That's true.
In the past, it's usually 3 years and above. Now,
Uh-huh.
it's realistic for me to think that they will stay with me at least for 2 years because I'm gonna talk them into going back to school. So now the 2 years will, they still need to stay with me
Uh-huh.
until they
Mhm.
graduate, and that's how it's been my strategy.
I see. A
Yeah,
great
Okay.
strategy. I mean, you do good forecasting. I
yeah,
wish I've learned that from you when I was a CNO. However, um, it here in California, in Southern California, we've done so
Mhm.
much creative staffing. I don't know if your ratios are legislated or mandated, and
Yeah.
here we have to apply. The, oh, before I answer that, what strategies did you do when you're really short? So I.
When we're really short. So when we're, like I said, I probably don't feel the void as much because the staff really rally to make sure.
Mm,
Like
Mhm.
today, this morning, I have only 14 staff members. Three, they're supposed to be 17. Three of them got sick, so they're down to 14.
uh
Mhm.
huh.
Then I have the resource nurse and I have the attending nurse. So technically, I have 16 nurses,
Oh.
and
Mhm.
I saw them working. It's really a team effort.
Uh huh.
So a few of the nurses have two assignments, and then they have to have an admission. But then the resource nurse and the attending nurse are helping them out.
I see.
So I never really um, experienced that I have shortage.
I
They
see.
they really work very
Mhm.
hard. My colleagues, though, in other ICU, like one of them are texting me. It's like, do you have any travel nurses they can spare? Because I said, like, I was talking to my CNO this morning, and I said to her, it really is, because she asked me, how'd you do it? How come you're not closing bed? It seems like you're not stressed out with staffing. And I said, it's the culture of the MICU. I mean, you set that from the
Mhm.
minute that you run the unit. You tell them this is what you want. They know what my staffing look like.
That's
They
true.
know why we need the nurses. They know about acuity or documentation, but it doesn't happen overnight.
Mm-hmm.
You train them to be
Mhm.
like that. So I think for my other colleagues, I think that's what they should do. It's
Yeah.
like really train the
Mhm.
nurses to be a team player. Don't look at numbers. Like,
Yeah.
so, okay, I am one to one or one to two. Don't look at it that way.
Yeah.
Look at what you can produce as a team. One of you might
Mhm.
be able to have a three patient assignment, but you have the resource nurse to help you.
Help you.
So I mean, not really that they have three patient assignment, but it feels like that because of the
Yeah.
acuity.
Mhm.
I am really
Mhm.
hopeful that they will continue to be like that, because the more you bring more new people in, um, the culture will change.
Yeah.
And that's why I
Uh-huh.
always have a retreat twice a year. This year,
Oh,
2020 and 2021, I did four,
that's
because I have
good.
so many
Wow.
people coming in.
Yeah.
And one of my colleagues were saying, asking me, it's like, how do you pay them? And I said, I pay them the same way. I said, but they're not working on the bedside. And I said, who cares? I
Yeah.
mean, the return of investment for 4 hours of retreat is much more than keeping them on the bedside. I said, do you know how much comfort they have when you bring them out of the bedside and put them in one place, and then you just
That's
have some
true.
team building activity? I mean, it's
That's true.
just like so rewarding for them.
That's
And I
true.
said, I will do that. And nobody had told me I shouldn't do it. Finance people didn't say I shouldn't do it. I mean, I
Wow.
continue on doing it.
You're
Yeah. But
lucky.
they see the outcome, though. I mean, my volume, the acuity. I mean, MICU is not, and Cindy will know this, they're not really money making like cardiac and cancer patients,
Uh-huh.
but we keep the beds full, and our
Yeah.
turnover of patients is fast. We make them
Mhm.
go to another, or transfer to the floor very fast. We take care of them very well, and so they see that. That's why
Mm-hmm.
they really
Mhm.
don't question me when I make those decisions.
I
I'm
see.
happy. I'm happy I could make the decision. I've been in a place where every single, it's like nickel and dime. It's a for-profit world before Mass
That's
General.
true.
And I know I was aching so bad. And I said to them, I'm going to have to leave because my values are not the same. I said, each patient deserves a staff. And if they're not going to provide that, I don't see me running a healthcare environment that nurses are being seen like just a pawn or like a
Mm,
body. They're
yeah.
not.
Mhm.
And I'm so glad I moved to St. Elizabeth's. It was St. Elizabeth's before I moved to Mass General, and it
Oh,
was more rewarding
Yeah.
there.
that's true.
Yeah,
That's true.
Good to hear.
yeah,
So, as you're hiring these new nurses, Jeanette, so a lot of them probably this, like you mentioned, some are 0 to 1 year experience and some are like one to
Mm-hmm.
five. What are you finding to be their challenges and how are you addressing them? Now, I heard you talk about focus groups, retreats, but what are their major concerns, challenges, and issues being new to
yes,
MICU? And what are you all
yes.
doing? Can you share it to
Right. So
us?
like now, because we still have COVID, we only had one day. That was
Mhm.
the tail end of the Joint Commission visit. We only have one day when we have zero COVID patient. Just one day. We were
Mm,
able to transfer our last COVID patient that was in June. And then from then on,
Mhm.
we're still getting COVID patients. And now it's half of my floors again COVID patients. So that's a challenge, is to maintain the mental and emotional, psychological well being of
Mhm.
my staff because of all these unvaccinated patients. And so I have to be very thoughtful on making sure they
Mhm.
are well supported, not necessarily
Mhm.
their skill set, because I have a lot of resources like attending RNs, the resource, my clinical nurse specialist, but more so
Mhm.
for them to feel good about what they do, even though we have deaths left and right.
Uh-huh.
Patients
Mhm.
are not doing well. It's emotionally challenging for newer staff. So
Uh-huh.
Mhm.
that's where I'm focusing on. It's really for their mental and emotional well being.
I see.
So we have, and that's why I was still doing some focus group resiliency rounds and things like that. Then the second part
Mhm.
is the skill set. So of
Mm.
course, like
Mhm.
60% are less than 5 years. 30%
Mhm.
of that 60 are 1 year, and of course they don't have the skill set yet. So
Uh-huh.
I'm
Right.
worried that come winter time we have like 9 ECMOs again, and they are not ready for that yet. So I told my
Mhm.
clinical nurse specialist we gotta have to speed up. We have, like, in the times of pandemic, the way you do things before is not gonna work.
Yeah.
You gotta really have to,
Mm.
your mindset should change. Like my clinical nurse
Mhm.
specialist, she says, okay, they have to be at least 2 years in the MICU before they could take an ECMO patient. I said, no, no, we will do it by skill set and readiness. If the
Mm-hmm.
staff are
Mhm.
ready, and these millennials and Gen
Oh
Zs, they're
yeah.
so bright. They're like a
Mhm.
sponge. You tell them something and they know it. So I said,
Mm-hmm.
that's what you're going to have to do.
Nice.
Like, find out who among the staff are ready. And I don't care if you're only 1 year, you got to have to train them
Mhm.
Mm.
and give them all the ammunition so that they have the opportunity to learn at the bedside while we still have all the seasoned nurses. So that's basically
Mhm.
where the challenges I have. The third challenge is recruitment and retention. And honestly, I'm not worried about that as of yet. Like, as of today, I still have about 3 people lined up to come to me between January and March. I will worry about the 8 that I have to replace when they graduate in May. But I already have
Mhm.
plans to bring in a new grad in March again, about 3 of that. And then I will start recruiting from outside
Mm.
as early as
Mhm.
December.
I
So
see.
I just have to be very ahead.
I see.
Yeah.
Mhm.
So vaccination mandates. Was you
Yes.
Massachusetts affected by that, you know?
Yes.
Oh,
Yes, we did.
okay.
Governor Baker mandated all hospitals to have our employees be vaccinated. We did lose a few employees. Again, in
Mm.
my unit didn't. All of
Ah.
them got vaccinated, even to the last minute. They said, "Yeah, they keep pushing it back up to the very deadline," and they were able to. But we did, in some of the areas that we did lose a few
Mhm.
nurses. They jumped to New Hampshire because it's not mandated there.
Oh,
So many of
I
my
see.
colleagues lost nurses to a neighboring state that is not mandated.
Oh.
Um, I think part of the states mandating vaccination is
Mhm.
because Boston is a medical mecca. We have a lot of
Oh,
hospitals here,
I
and so
see.
if they don't mandate it, they're afraid that it's a high risk
That's
for
right.
patients as well
Mhm.
as for healthcare workers to be
That's true.
exposed.
Mm, that's
So
true.
I
Mhm.
personally feel that it's a good thing that we
Mhm.
did that. I do understand that it's a right of an individual to refuse, but
Mhm.
again, my I always talk to the staff about your moral and ethical principles. That yes, you need to compromise. Yes, it's a right. It's the liberty. United States is very big on that. It's a
Mhm.
right to choose what you want, but you also have to
Mhm.
compromise with the fact that you are protecting the health of the nation, and
That's right.
therefore you
Mhm.
gotta have to compromise your values or your beliefs in order to protect the health of the nation. And so
Mhm.
they understood,
Yeah, that's good.
and
Mhm.
I will be very honest. There were several patients who were unvaccinated, and it really broke my heart. It was
Mm.
one of them was a young. They were not immigrant. They don't have. They are here to work, and there's from Hispanic and Black Americans, and they went to Boston for job.
Mm-hmm.
So they don't have any visa at all.
Mm-hmm.
And
Mhm.
she was pregnant,
Mm.
and her fiance and her didn't want to get vaccinated because they're afraid of the complication.
Uh-huh.
If they have complication, they're going to be out of work, so they don't have any means to sustain themselves.
Oh,
They don't have health
Right.
insurance, so that's the reason why they don't want to get vaccinated.
I see.
Unfortunately, they got COVID,
Mm.
the mother. So we delivered her baby, thank God. Sent her to the NICU,
Uh,
but unfortunately she passed away. She
oh,
didn't make it.
wow.
But yes, just in the nick of time, on the day that she was going to pass, our social work was able to get custody of the child to the father. They
Uh-huh.
worked it in City Hall because they're not married yet. So we were
Oh,
able to get her husband or her fiance to get custody of the child.
I
Otherwise, it will
know.
be awarded to the state. It's just so
Wow,
sad.
that's true.
In fact, yeah, my staff are putting together like gifts for them for Christmas. They will
Oh,
be
that's
our
nice.
yeah, yeah, I know. It was so
That is
nice.
so
Getting
nice.
some work clothes for the husband, and our legal department are also trying to get them an immigrant status
Oh,
because the baby
wow.
is
Mhm.
an American citizen. She was born here.
Oh, that's
Like, I
right.
think they can do that. It's amazing.
Yeah.
Yeah. So,
Yeah.
good things and really sad things,
Yeah.
Right.
but
That's true.
sometimes I do understand why people doesn't want to be vaccinated.
Mm. Okay, I see.
Mhm.
But I will still support vaccination, really, true. I think that's the only way
Yeah.
we will be able to get through this,
Oh,
especially with this new variant that's coming out,
Yeah.
and I don't know. I mean, I mean, California did a very good job containing your COVID. Florida and Texas, I think, and Northwest is not um, as I think contained as well as
Mhm.
California. I think New York is
Right.
still devastated by it. Boston has been fine. We're one of the well
Mhm.
vaccinated state in the
mm-hmm.
nation,
Mm-hmm.
so that's
Yes.
good.
Yeah,
Yeah, so
that's
Yeah.
good.
it's a lot. Yeah.
Yeah. So how are you now, Jeanette? I mean,
So
you did,
yeah,
you had
I'm
COVID,
doing
you're back
very
to
well.
work. How are
Yeah,
you?
doing well. One of my focus right now is making sure that I have no long term complication,
Mm.
Mhm.
because
Mhm.
my pulmonologist says that I should have PFT, like pulmonary function test, every
Mhm.
year. I have to go back to my colonoscopy because I haven't really gone back since it was canceled 2 years ago, 2020. So I have to make sure
Yeah.
I take care of myself.
Mm.
I exercise
Yeah.
a lot now. I put on weight again after I lost about 25 pounds in 2 weeks during my illness. So I had to put it back in a healthy way. So I'm really
Mhm.
focusing on that right now. The Filipino Cancer Network of New England is kind of a baby to me.
Mm-hmm.
I'm really very passionate about helping our president, Cheat Abraham, making sure we are able to help the community.
Mm-hmm.
I like
Mhm.
that, and I'm going back to school. I'm actually
Oh.
on my first class. It's not a course. It's not a course. It's not a matriculated one, but it's more of a credential.
Mhm.
It's called the Public
Yeah.
Leadership Credential at Harvard Kennedy School. So I just
Mm.
finished my
Yeah.
first course. The next one is in January. So I'm trying to see if I'm gonna enroll. It's no pressure for you to enroll if you don't want to, but it takes about 2 years to finish to get the credential
Mhm.
Uh-huh.
at your own pace. So I'm doing that right
Uh-huh.
now. That's where my my focus is, and
Yeah.
then I'm doing my
Mhm.
book. Initially, I thought I will just speak about my illness. And then when I came
Mhm.
back to work, I said, oh my God, there's so much to write about. So
Uh-huh.
now I'm writing about
Mhm.
post. Uh, Post my illness, how when I came back to work, and
Mhm.
then 1 year happened, and I there's more to there's more to write again because the pandemic continues. So yeah, so I'm
Right.
halfway there. I
Oh.
already have a
Mhm.
title. I call it silk thread, which means that one of my nurses says, like to me, we're hanging like a thread. And I told them, I said, I hope it's silk
Oh.
thread because
Uh-huh.
it's stronger. It's
Uh-huh.
flexible. And this, oh yeah, you're right. Yeah, that's how we are. We're so resilient. And I said, okay. So my hope is by 2022 I'll finish it.
Oh,
Yeah,
wow. That's a
yeah.
great aspiration. I wish I can
Yes.
be like
Yeah,
you.
that will be my first book that I I wrote, and my staff were telling me, "Did you get a publisher yet?" And I said, "No, I don't." They said, "So how are you going to publish it?" And I said, "I'll pay it myself." You will? I said, and they said, "We'll do fundraising for you."
Gosh.
He says
So,
no, and then teaching me how to get a publisher and things like that. And I said, okay. But right now I said, I need to finish it first and then I'll have it edited. And then that's when I'm going to think about publishing. And then they told me, no, the minute that you write something, you start thinking of publishing right away. So
oh,
they're telling me all this strategies,
I see.
basically. So I'm
I'm
excited about
yeah.
it.
I'm so
I
happy
thought,
for I'm so happy that it's going more on a positive note for you.
yeah,
Trying to learn more new things, life it's a lifelong learning. Well,
yes.
we mentioned about Omicron a while ago. So how
Mhm.
is UMass preparing for it? Are we preparing what I mean, are we
So
preparing for it?
they are just contact tracing. They're doing a lot of that right now. So that's why they found that we have one case here, but
Mhm.
the individual is at home. He's doing fine, and so they're just monitoring
Mm,
everybody. So like right now, like for me, for example, and even just a sneeze or like cold symptoms, I tell my staff, don't come, go and get tested.
uh-huh.
And most of the void of staffing right now are because of symptoms of the healthcare workers,
Mhm.
because we don't want them to come
Ah,
to work when they have symptoms. So I
I
have many of
see.
those.
I
And I
see.
think it's a good strategy because what if they do test positive and at least you're contained already? And like yesterday, I know that the hospital will start doing some testing again, like on site.
Ah,
And especially with the holidays coming up, people are
mhm.
are more like getting together. Social distancing is
Yes,
not in effect, so we're preparing for that.
I
It
see.
did. Our cases went up a little bit after Thanksgiving, which we projected,
Mhm.
Mm,
but then it went
Yeah.
down again. So for Christmas and New Year, we're just getting ready for that.
I see. That's
Yeah,
good. That's
yeah,
good.
I know.
Well, Jeanette, this has been a very wonderful conversation about COVID, getting sick and surviving
Mm,
COVID, going back to work and managing a medical ICU as a nurse director, writing a
I
book, Silk
know.
Thread.
Wow.
This I've enjoyed. We have enjoyed our
thank
conversations.
you.
And to wrap this up,
Mm.
Jeanette, what would you say to those that are still hesitant to get the COVID vaccine?
You know what I'm gonna tell them is my story.
Ah,
I didn't know how I got it. I know during that time frame we are not masking yet, and I was
uh-huh.
really trying to help out. Like I don't go into the patient's room; they don't allow me to go in patient's room. But the minute that they get out of the room, I check on their mask. Are they on the right, things like that. And because when we're outside, we don't have a mask. We I must have been exposed. But
Um,
honestly, I can tell them the number of patients that we lost because they're not vaccinated and they are young and they're leaving like infants, children. And I would be very, I would like to see them. This is how it's going to look like. And you may think that you are immune to it or you're not going to get affected, but you're wrong because anybody can get affected.
yeah.
And many times they will tell us, like, intubate me now and do things, oh, this, can I have this, can I have that, but it's kind of too late already. Their lungs has been
Mhm.
full of COVID already. They cannot
Mhm.
survive anymore, and they leave their loved ones behind, and you don't want that.
Mhm.
Yeah.
especially the younger
Right.
generation right now, because they feel like it's a myth. They think
Mhm.
it was one of those what do you call this, um, like they're attacking United States and other countries so that
Mhm.
they will rule the world. That's how they think. But I told them it's not
Mhm.
like that at all. It's really true. I mean, COVID is bad,
Mhm.
Yeah.
and the vaccine
Right.
has proven for you a proven avenue to protect yourself. It doesn't say that you cannot be diagnosed with COVID again, but at least the complication
Mhm.
is less. It's not like when I had it.
Right.
Mm,
So, it's still very effective.
yeah. That's good.
And that's what I'm gonna tell them.
All right. Thank
Thank
you.
you. And that is all that we have for this episode. I want to thank our guest, Dr. Jeanette Livelo, and my co host, Mindy Ofiana, our director and producer, Rodney Cahudo, Carol Robles, the PNAA Chair for Communications and Marketing, our advisor, PNAA Foundation President Nancy Hoff, and our executive producers, PNAA President Mary Joy Garcia Dia, and PNAA Executive Director Carmina Bautista. Join us every Wednesday here on Rise Up. Until then, keep on rising. See you next
Thank
week.
you. Thank you.
Thank you. This publication was made possible by Cooperative Agreement CDC RFA IP 21-2106 from the Centers for Disease Control and Prevention of the U.S. Department of Health and Human Services. Its contents are solely the responsibility of the authors and do not necessarily represent the official views of CDC HHS.